Governor Jay Inslee asking for federal help as hospitals in our state are just overwhelmed right now.
And Q13's Brandi Kruse is here now. This is reminiscent of the start of the pandemic when hospital space was in short supply.
Yeah, there was talk of what can the federal government do. I mean, they sent, giant ships to New York City, down to Los Angeles. We had a field hospital here that came to help. Governor Jay Inslee, this letter he wrote to the head of the COVID-19 response for the federal government is sort of, it's invoking shades of that, those early stages of the pandemic. The governor writing in part, our hospitals were nearing capacity this summer before the Delta variant hit our state. Much of this volume was due to delayed care during the early part of the pandemic. The governor went on to say the hospitals have surged to increase staffed beds and stretch staff and have canceled most non-urgent procedures, but are still over capacity across the state. And there is some acknowledgement of what else is happening here. Dr. John Herson, he's with Legacy Salmon Creek Medical Center in Vancouver, Washington, and he acknowledged a couple of the other issues besides just COVID cases that are complicating things.
We continue to deal with a situation where we're seeing extreme burnout and fatigue from our clinical staff and support staff. Many are choosing to leave the profession, and obviously the mandate will only cause others to potentially leave as well.
So not only do you have staffing issues, this doctor in Vancouver, Washington, acknowledging that after the October 18th deadline that most medical personnel have to get vaccinated, that there are going to be some who leave, and it is going to worsen the staffing situations at our hospitals. And so certainly we need to prepare for that realistic possibility as well.
So I do think it's interesting that we're talking about, what we did back in April or so of 2020 when we had those field hospitals. We didn't end up needing them. So if we do this and we don't need it, is it premature to do so?
Well, the thing is you want to do it before it's too late,
Sure.
right? And I think we've got video, right, of those hospitals. If you guys remember this, it was such a short-lived period of time where they rushed in, set up this hospital at CenturyLink, and then it seemed like the next day the governor's like, you know what, send this to another place. He also sent back a lot of ventilators that the federal government had sent us. In a situation like this, it seems as if better to have it and not need it than better to need it and not have it. And also, as the doctor from Vancouver, Washington pointed out, we could be in a much worse situation as it pertains to hospital staffing come October the 18th after that vaccine mandate. We don't know at this point how many healthcare workers in our state of the roughly 400,000 people under that mandate currently are not vaccinated. And so for some of these hospitals, especially in smaller areas, if you've got like 2 nurses who aren't vaccinated and you lose them, that's already adding, to the challenges there. So I think the governor is probably just trying to get out ahead of a situation. He's requesting